So welcome everybody to the virtual prenatal class. This is going to replace my in-person prenatal class during the time of COVID. You do not need to take notes because everything I will say is available on my website. And so if you Google Mark Rosengarten MD, you'll find my website, and then you will go to the prenatal class companion and you can download this. Now ladies, there are 11 pages for you to read. Please read them to your partners. Guys, just the last page is yours. Just 3 points that you have to remember, just 3. Ladies, 10 pages, gentlemen, 3 points, and there are some bonus points as well. So I would strongly suggest you read the bonus points. The prenatal class is going to be done in easy to watch and easy to digest segments. We're going to go through from 36 weeks until the end of the 100 days of hell. This class is a very all-encompassing class that it will go through what is most likely to happen to most of you most of the time. Everybody has their own birthing experience, and it may be exactly as they had planned, and sometimes it's not as they had planned. But for the most part, this is what most patients can expect to happen to them in the 3rd trimester until 3 months out. So we're going to start with the 3rd trimester. And unfortunately, everyone wants to give a pregnant woman advice because advice is easy to give. And I'm sure that every time you walk down the street, someone has to put their hand on your stomach and tell you how big you are or how small you are. You have dropped, you haven't dropped. The baby is going to be a boy, the baby is going to be a girl. So advice is easy to give. In the 3rd trimester, there is nothing that you need to start doing, which you have not started doing already, and nothing that you need to stop doing. People will tell you to have sex while driving on a bumpy road, eating spicy food, having acupuncture, and doing jumping jacks. Trust me, I've tried all that, and all that it does is give you a sore back. If you want to do that, there's no harm in doing it, but I strongly suggest you don't do it. If you are exercising and you are enjoying exercising, keep exercising. If you are exercising and not enjoying it, stop. It is not going to make a difference. There is no reason to change anything in your diet, no activity. You can be sexually active if you want to. You do not need to start or stop doing anything that feels uncomfortable. In the 3rd trimester, it is normal to have a little bit of spotting and bleeding, and that is normal. So on the panty liner, you may see a little bit of pinkish discharge, brownish discharge, or even fresh bleeding. Please do not take pictures of it and text them to me. I'm not interested. So a small amount of bleeding is completely normal. The textbooks will talk about losing a mucus plug. You can lose many things in life. You can lose your keys, you can lose your phone, you can lose a pet, but you cannot lose a mucus plug. There is no such thing as a mucus plug. It is just mucus made in the birth canal and in the cervix, and it may come out. And what it looks like is a ball of snot. And once again, please do not take pictures of it or send it to me. I'm not interested. If you see a mucus plug, it means absolutely nothing. It does not mean that the baby is going to fall out, because the mucus plug does not hold the baby in. It is just mucus, and if it comes out, your body will make more. So do not stay awake at night waiting for your mucus plug to show up. A bloody show is also a very rare thing, and a bloody show is mucus and blood mixed together, and once again, most patients do not see a bloody show. Now, if you do see some blood and mucus mixed together, once again, don't run out the front door and rush to the hospital. It means nothing. If you see a bloody show, there is a slightly higher chance of you going into labor within the next 24 to 48 hours. But once again, the majority of you will not lose a mucus plug and will not see a bloody show. Bleeding. As I said before, a little bit of staining, a little bit of spotting is completely normal. However, if you have soaked a pad with blood, or if there is blood running down your leg, that is not normal, and you do not go back to sleep or continuing with your shopping. If you have soaked a pad with blood, or if you have blood running down your leg, it is time to come to the hospital. You do not need to phone anybody. You just proceed directly to BC Women's Hospital. There is no such thing as too much baby movement. Babies move all the time, and as you get into the third trimester, you will probably notice the movement of the baby changes. It slows down and typically only moves after meals, and the type of movement changes as well, from a kicking and punching to more of a rolling and a stretching movement, and that is normal. There is a really crazy movement which often shows up towards the end of the pregnancy. It's a shuddering, shaking movement which often happens at nighttime, and it commonly causes moms a bit of distress. They feel like the baby may be having a seizure, or we often get phone calls at night saying, I turned over and my baby started shaking. Did I snap the leg or did I crush the cord? The shaking movement is a normal thing. It is nothing to worry about. If you don't feel it, it is fine. And if you do feel it, it is nothing to worry about. So there is no such thing as too much movement, and I do not want you walking around counting fetal movements. I do not want you counting movements. The one thing we do worry about is no movement, particularly at the end of the pregnancy. As babies get closer to their due date, they move less, and the type of movement is, as I said, not as extreme. It's more of a rolling and a stretching. And so if you are busy, you may miss some of those movements. So no such thing as too much movement, but if you have not felt any movement, no movement whatsoever in 4 to 5 hours, this is what you're going to do. You're not going to panic. You're going to sit down in a quiet place. You're going to have something sweet and something cold to eat or drink. So you'll have some juice, some candy, something cold and sweet, and you will sit still for 1 hour. And in that hour, we want you to feel 3 movements. They don't have to be big movements, but you should feel 3 movements in the hour after eating and drinking. And if your baby does move, off you go, continue as normal. But if you have not felt any movement whatsoever in 4 hours, and if you have sat down and you've had something to eat and drink, and you still have not felt the baby move in that hour, you do not panic, but we want to see you at BC Women's Hospital. So get into your car, turn on the radio, because bass sounds stimulate the baby, and you drive slowly to the hospital. And what happens on the way to the hospital? Your baby will start to move, and so you will turn the car around, stop at Timmy's, get a coffee, and go home. But if you have not felt any movement and you've had something to eat or drink and you are worried, we want to see you at BC Women's Hospital. We all watch movies, we all watch TV dramas, and there has to be a pregnant woman in every one of these situations. And what happens to the pregnant woman in the movie? Her water breaks. And where does her water break? It usually breaks at a dinner party, at a reception. And how does it break? There's usually a soaking gush that everyone can see, and then the next scene cuts to her huffing and puffing in the back of a cab and then having the baby. In real life, only 10% of women break their waters before they're at the hospital. So everyone expects their water to break and then to go to the hospital. That is probably not going to happen for most of you. Most of you will go into labor, get to the hospital, and then your waters will break, and if they do not, we will break them for you. If your water breaks, it usually happens at nighttime, and it is usually not that crazy soaking gush in the middle of a reception party where you're going to need a cleanup crew in aisle 3. It is usually a leaking, and moms typically get up to go to the washroom, and they notice a dampness on their underwear, in their pad, or even a little spot in the bed, and they think, I wonder what that is from. Maybe I have peed myself. and anyway they go to the washroom, and on the way back to bed they notice a trickling of water down their legs. So that is the typical, I think I have broken my water scenario. A few women, as I've said, do feel a pop and then a big gush of fluid that both them and everybody else can see. But the majority of women, if they break their water, and most won't break their water, if they break their water, all they notice is a dampness and an ongoing leak. Now, how do you differentiate the normal discharge from water breaking? It is normal to have a heavier discharge towards the end of the pregnancy, and if you're lying or sitting for a long period of time, as you move, you may notice a small discharge, a small trickle. That's a one-off kind of thing. But if your waters have broken, you will feel a continuous leakage of fluid, which may not be apparent right away, but after an hour or so, you'll be thinking, I've had to change 2 or 3 pads in the last 2 to 3 hours. Maybe my waters have broken. So if you know your waters have broken, or if you think your waters have broken, this is what you're going to do. You're not going to panic. You're going to have a shower, and you're going to eat something and come to the hospital. Now, if your water breaks, we would like to see you at the hospital within about 4 to 5 hours. You do not need to rush to the hospital right away. It is not a 911 call. We would like to see you within about 4 to 5 hours of your water breaking. Now, some moms may have a Group B strep positive swab, and if you are positive for Group B strep, once again, you do not need to rush to the hospital. We would like to see you within about 4 to 5 hours. So you don't do anything different. You still have a shower, you still eat something, and you come to the hospital. One exception, if the water is green. If the water is green, it is typically clear, yellow, or even pinkish. But if the water is green, it can mean that baby has had a poo inside the uterus. And in some cases, not in all cases, in some cases, that may mean baby may be a bit stressed. So if you see the water, if the stain on the underwear or the pad is a little green, once again, have a shower, eat something, but let's see you sooner rather than later. So you'll come to the hospital, you'll come to BC Women's Hospital, you will check in, and we will examine you. And a lot of patients, a lot of moms who think their waters have broken, have not broken their waters, and what happens to them? We send them home. But if you have broken your waters, this is what is most likely going to happen. Typically, if you break your waters, most women will go into labor by themselves within the next 2 to 3 hours. So that's why we say don't rush to the hospital. And if you're at the hospital and you are not going into labor, and if your waters have broken, this is what is going to happen. We are going to admit you, and we're going to induce your labor, not seduce you. That's already been done. We're going to induce you. We're going to get your labor started. Why? Because when the waters have broken, there's now a connection between the birth canal and the baby, and that increases risk of infection to baby. So if your waters have broken and you're not going into labor, we are going to induce you. And this is how it works. We will admit you, we will start an IV, and we will give you a natural labor drug called oxytocin. And when we give you oxytocin, it will slowly build up your contractions. And so oxytocin is a natural hormone, it's the labor hormone, and we give it to you in very small amounts, and so that is how we induce you. The only problem with the oxytocin is that when we start it, you cannot eat. You can drink, you're able to walk around, but the one thing is you cannot eat, and that's why I say before you come to the hospital, have a shower, eat something, and make your way in.